I'm still hopeful it won't happen, but the House Republican Study Committee proposed a full repeal of the Inflation Reduction Act in the fiscal year 2025 budget proposal, which, while it is unclear whether Trump supports repealing this law in its entirety, doing so would eliminate the $35 insulin copay cap for millions of insulin users with Medicare and leave in its place only voluntary efforts offered by the three major insulin manufacturers, which apply to many people irrespective of their health coverage. Medicare enrollees now pay no more than $35 a month for each of their insulin prescriptions, thanks to the Inflation Reduction Act, which Democratic lawmakers pushed through Congress in 2022. My family was able to benefit from the Inflation Reduction Act by being able to purchase insulin with the $35 copay. So it was a big help for us, yes. In other endocrine news, White House wants Medicare, Medicaid to cover GLP-1 drugs. In this November 26, 2024 report, the Biden administration wants to expand coverage for the GLP-1 drugs like Ozempic and Wegovy under the Medicare and Medicaid programs. The drugs previously were not required to be covered due to a tangle of laws and policies, among them one that said Medicare Part D plans cannot cover weight loss drugs. In its announcement, the Biden administration called anti-obesity medicines life-saving drugs, noting that they can also prevent diabetes. But far too many Americans aren't able to use these critical treatments because they're too expensive and out of reach. Without insurance coverage, these drugs can cost someone as much as $1,000 a month. We all know that the price of the drugs internationally is a lot lower. A one-year supply of Wegovy purchased at list price is more than $16,000. The White House said the new plan would reduce out-of-pocket costs by 95%, which would mean that a person could pay around $800 per year for Wegovy, for example. It's unacceptable that Americans, especially those without insurance coverage for these drugs, are forced to pay so much for life-saving medications. The proposed rule would be implemented at the same time as a comprehensive agenda to lower the cost of drugs, including the drug price negotiation program and increased market competition. We can lower drug prices and improve health outcomes for Americans. Yes, you can. The new coverage would affect about 3.4 million people with Medicare and about 4 million adults who have Medicaid, according to the White House. Estimates have put the cost to Medicare for expanding coverage at $25 billion over a decade. And this is according to the New York Times. Medicare coverage under Part D plans has previously been limited to GLP-1 drugs that are FDA approved for non-weight loss conditions such as treating diabetes or reducing cardiovascular disease risk. But Part D plans are not required to cover GLP-1 drugs at all, just drugs that treat diabetes or cardiovascular disease. We're going to get it together one of these days. I know we are. Don't give up, people.